So we're going to turn on replacement pharmacotherapy to treat methamphetamine and amphetamine use disorder. There have been several studies that have looked at this option. The outcome for almost all of these studies that we'll be talking about is the percent of urine specimens positive for methamphetamine or cocaine. In this case, the patients were treated with dexamphetamine, 60 milligrams per day, compared to placebo, with 30 patients per condition. And what you can see is over 8 weeks of study, there's really no difference in methamphetamine use. So the idea of substituting amphetamines for methamphetamine use disorder does not seem to hold much merit. I want to take just a sidestep for a moment to mention more about attention deficit hyperactivity disorder. And in this study, it was an in-depth study of 51 patients who had methamphetamine use disorder, and the instrument called the Wender-Utah Rating Scale, which was designed to screen for ADHD. It asked about a lot of childhood behaviors, was administered to all of these patients. And you can see that 70% of them screened positive for ADHD. Now, this doesn't absolutely confirm the diagnosis of ADHD, but it makes it very likely. And so those that screened positive for ADHD reported much higher rates of methamphetamine use in the prior 30 days. So we know that these two disorders travel together and can influence each other. And it's relevant because of the idea of using stimulant treatment for stimulant use disorder. This amphetamine use disorder study compared aripiprazole to methylphenidate. Methylphenidate is a stimulant medication which is indicated for the treatment of ADHD, and that primarily acts similarly to cocaine. These two active medications were compared to placebo, and they were treated for 20 weeks. The aripiprazole dose was 15 milligrams per day, and this was a slow-release form of methylphenidate that was titrated upward to 54 milligrams per day. So in the table, we're looking at the outcome at the percentage of urine drug screens that were positive for amphetamines. And you can see for placebo, that was 82%, whereas for aripiprazole, it was even worse. It was 90% were positive, which was a significant difference from placebo. And so aripiprazole is not only not effective, it may make people worse. And then the methylphenidate actually outperformed placebo. So there is a signal there that treating amphetamine use disorder with methylphenidate, which is a slightly different mechanism of action, may be somewhat beneficial. This study, again, looked at methylphenidate. In this case, it was for people who had co-occurring attention deficit hyperactivity disorder and amphetamine use disorder. In this study, they used much higher doses than were used in the study we just presented. So this was osmotic release methylphenidate, and they went between 96 milligrams per day up to 180 milligrams per day. There were 27 patients in each condition. And we're looking on the y-axis at the proportion of negative urine toxicology screens for amphetamine over the 24 study weeks. And you can see that the methylphenidate group performed twice the number that the placebo group was getting. So methylphenidate at higher doses is beginning to look really good. Here's one more methamphetamine use disorder study on methylphenidate that did not really look at whether people had attention deficit hyperactivity disorder or not. So there were 28 people in each condition. In this case, they also used the 54 milligrams per day. Now we're looking at percent positive urine drug screen. The black bars represent the methylphenidate group. The gray bars represent placebo. And you can see initially there wasn't much difference, but as time goes on, the patients treated with methylphenidate on average were giving a lower percentage of positive urine drug screens. So we have sufficient data now to suggest that methylphenidate may be a very useful treatment for methamphetamine use disorder, and we will need larger, multi-site, really well-performed randomized trials to confirm that, because you see these studies are small studies. But in the meantime, it's something worth considering as an off-label treatment if nothing else is working. So amphetamines as a replacement pharmacotherapy for methamphetamine use disorder do not show much benefit. In contrast, methylphenidate does show a positive signal for some extent for people who don't have ADHD, but definitely for those who do have underlying ADHD, which of course is common in this population. And we need to study methylphenidate further and much larger studies before we could ever say that's your go-to medication for methamphetamine use disorder, but there's certainly some promise there.